Welcome everybody to the first echo for 2025 for type 2 diabetes in far western New South Wales. Might just go on to the next slide. Just like to start tonight with an acknowledgement of country. I'd like to acknowledge the traditional custodians of country throughout Western New South Wales and their connections to land, water and community. I pay respect to elders past, present and future and extend that respect and a warm welcome to all First Nations people present today. So tonight I'm joined on the panel by Dr. Manik Maradune. He's an endocrinologist at Orange Hospital. I'm Alex Helmer, GP in Merlong. We've got Alison Amor, a credentialed diabetes educator. Dr. Martin Watson, GP in Orange, and Amanda Taylor, CDE and pharmacist. So just a little bit of housekeeping. We really encourage you all to turn on your webcam so we can see each other and feel a bit more like we're in the room together. But just to leave your microphone on mute except when you're speaking. We do encourage you to speak up when you've got questions. We've got plenty of time during the evening to ask questions if this is your first time doing an echo. So you can, if you don't feel like speaking up, you can just place a question in the chat, or you can use the hand up feature and we'll get to you. It is important to remember that we live and work in small communities, and it can be easy to identify patients, and it's really important that we maintain confidentiality even if you do recognise who the patient may be. And just a reminder, as always, that our language matters. The words used to talk about diabetes affect the physical and emotional health of people living with diabetes. They also affect how people in society view people living with diabetes. Our words need to show that we care and remove bias and blame. So you might ask yourself, people with diabetes call themselves diabetic, so why shouldn't I? Evidence shows that 1 in 2 people find the label unacceptable and 1 in 4 find it harmful. People with diabetes are free to use whatever words they wish. Other people, especially those of us in healthcare, have a responsibility to engage all people affected by diabetes in positive and helpful ways. So we'll move on to Alison, who's going to present our didactic session for this evening. Thanks, Alison.
Thanks, Alex, and thank you everyone for joining us tonight. Really excited to be getting back into the Echo series for 2025, and yeah, great opportunity to come along and share with you guys tonight. So looking forward to that. We've got 10 minutes, so we won't be able to cover a whole lot, but I think when we're thinking about the challenges faced at the initial discussion, we might just flick on to the next slide if that's okay. What are our priorities that we want to achieve in that initial discussion? And I guess one of the biggest challenges we face is where to start. You know, there's so many important messages that we want to share with people that have been diagnosed with diabetes and living with diabetes. And we all have a lot of knowledge and information that can be of value to people. But what are those really important messages that we need to get across in that initial contact? And, you know, thinking about how much are they going to remember from that? And also just being really mindful that everyone's really individual in how they're responding. So I think over the course of this quick presentation, we're going to look at what we sort of consider to be priorities of establishing the therapeutic relationship, setting up what realistic expectations for ongoing self-management looks like, so there's less chance of surprises along the way for the person, and also having a quick look at opportunities for NDSS registration and how that process has been streamlined. So just to sort of set the scene, my colleague actually shared me a nice little video via Instagram that I thought we might show. And Alex just talked to it briefly as well around that language and the impact that our language and our actions have on people living with diabetes, and the impact it has on them engaging in self-management and reaching out and accessing care.
I thought diabetics couldn't eat donuts.
Not making much progress, are we? diabetes.
Some diabetics couldn't eat donuts.
You even exercise and sit around on the sofa all day.
Just stop being so
Not making much progress, are we?
Check your sugar stone.
Sit around on the sofa. That's how you lose your foot. Oh, so many sweets. Didn't eat right.
You did it to yourself.
Under pressure. Under pressure. Pressure.
Thanks, Erin. I'm so relieved that worked. And I think that I get goosebumps when I watch that, because I think it just shows the impact that, even as health professionals, the profound impact that we can have on people and how they feel about having diabetes. And so when the slides come back up, I guess the first thing we're talking to is establishing that therapeutic relationship and the importance of creating a safe space for people to talk about diabetes. And we can probably skip past this because Alex has spoken fairly well to it, but just reminding everyone that the Diabetes Australia have got a information or a position statement on language, and as part of that, if we just flick to the next slide, there's some suggestions around the way we can change the language that we're using when we're working with people. I guess when we're thinking about setting up the therapeutic relationship, it's about removing that power imbalance in the consultation and making it okay for anything diabetes related to be discussed. We might just skip to the next slide there, please. And I think one of the key things around that is understanding how someone's feeling about being diagnosed with diabetes. So, there's a whole range of different emotions that can occur. There's no right or wrong. And, in some cases we see acceptance in communities where there's a really high prevalence of type 2 diabetes. Some people feel that it's inevitable that it's going to happen. For other people, it might be guilt or blame or shame, or a whole range of things. And I think over time we've become really aware that the impact that emotional wellbeing has on people and their self-management, and we're getting a lot better at screening for diabetes distress. And I think as part of that initial consultation, if we have that conversation and acknowledge what people are feeling, and acknowledge that it's not uncommon, acknowledge that the journey of living with diabetes has lots of ups and downs, and there may be periods of time where things do feel overwhelming, and making that okay and talking to reaching out when you're feeling like that, so that we can put some things in place so that even though you don't feel like doing much with your diabetes, we can still keep you safe and help you get through that. So we might just flip to the next slide, please. So the other thing that's really important is initially setting up some really healthy expectations around what diabetes self-management is going to look like for the individual, and helping them to understand that it really is a long-term plan. Even when we're talking about making changes to live well, the changes that we're making are for the long term, and setting up that expectation that, as part of your diabetes self-management, we will be catching up with you regularly. And the reality is, like, if we're doing the blood tests or if we're, working to the diabetes cycle of care, that requires regular catch-up. So just setting that expectation from the start, that they're the person that's living with diabetes and they will determine what their self-management looks like, but we are here to support them with that, and we'll help them navigate what that looks like. And the other probably helpful thing to introduce at this point is the concept that there'll be a team of people who can help you along the journey. And I think it's really helpful to introduce this up front, rather than waiting until perhaps maybe their HbA1c goes up and then things are looking a bit different, saying, oh, well, you need to go and see the diabetes educator now, or you need to go and see the dietitian now. Introducing the concept up front, so there's an expectation that, as it's not uncommon, or for anyone living with type 2 diabetes, it's quite normal for there to be a number of people involved in their care to help them along that journey. The other thing I wanted to talk to was just around NDSS registration, because I thought it might be useful to share some information around that for people who are on the call. The NDSS has now got an online health professional portal, and it's quite simple to register for. You log on to the website and sign up for the portal. So anyone who's able to complete the handwritten forms is able to have a online health professional portal and essentially access the same forms online. But what it does is it facilitates real-time input of the information, and it's not unusual for a new NDSS registration to be returned in 5 or 7 minutes. So if you're actually doing that at the start of a consultation, you can give them their NDSS number before they walk out of the room, which can be really helpful if they're going to need that in a more timely manner. So if we just flick to the next slide, it's quite simple to use. It's quite intuitive to log into. It uses multi-factor authentication. So you'll link your account with a mobile phone number, and you'll get sent a 6-digit code every time you go to log in. Essentially, the people who can register under the NDSS is your endocrinologist or GP and credentialed diabetes educator, but it's also practice nurses and Aboriginal health practitioners. So essentially, if you've got an AHPRA registration number, you will be able to have a health professional portal in the NDSS. I might just flip to the next slide. This will just go through some of the, some of the screens that you see when you're in there. As I said, it's really quite intuitive to navigate. So you can either, if you're wondering if someone is registered with the NDSS, you can jump in and just put in their Medicare card and their surname, and it'll either tell you whether they're in the system or not. If they're not, you can then elect to register someone. Or likewise, if someone's been on oral medication and they're now to start either some sort of injectable therapy, you can update their needle access so that they can then have subsidised needles when they go to the pharmacy to get their medication. So just this is the range of forms that's available on it. It does, it's difficult for me to test it out because I'm a credentialed diabetes educator, so I have access to all those forms, but essentially you should be able to register a client, do the blood sugar monitoring strips, do the syringe or pen needle access, and update their contact details. So anything that requires CGM or insulin pump type access is usually got a more restricted authority on those forms. And just the next screen will just show, once you've registered or put the client's information in, it's all the same information that you have on your handwritten forms, but you essentially just enter it straight into the computer. This is the message that'll come up. It says it takes 5 to 7 minutes, and then you can just flick into your forms and it'll show a progress of where they're up to. I've had them come through in less than 5 minutes before, and I've also had other ones that sit under review and take longer than the 7 minutes, but it's actually a really simple process, and it just, I guess it makes it a lot more streamlined and just faster. Yeah. So that's it from me. I didn't want to take up too much of your time, but yeah, I hope you found that helpful. And we can send out the link for the health professional portal in the follow-up from tonight, if that's helpful.
Thanks. Any questions? Anyone wants some clarification upon that? I've got one. My current method of filling out the NDSS forms is I ask my practice nurse to do it. Is she able to do that for me through this portal?
Absolutely. Yep. So your practice nurse, or if you're in an Aboriginal medical service or you've got an Aboriginal health practitioner as part of your team, they're also able to, when they go in, they'll set up their own health professional profile and it'll link their AHPRA number. And when you set that up, it gets forwarded on for approval, which is usually within the day, and then they'll get their access to the portal.
And so that's registered nurse and enrolled nurse, anyone with a...
Any
AHPRA
nurse that has an AHPRA number, yeah.
I'll take that our questions are exhausted. Any burning questions, just pop it in the chat and I'm sure it'll be answered during the course of the evening. But with that, we might move over to our case presentation. Now, Amanda's going to present our case study tonight, so I'll pass over.
Cool. Thanks, Alex, for that. Thanks, Elle, for that talk as well.
go to the next slide, there's just a few announcements. I feel like we need a newsletter, the amount of announcements we've got tonight. So firstly, our next ECHO session is in a month's time on the 10th of April at 7 p.m. So Amanda will be back to present a didactic of, or continuation of tonight's didactic. We do encourage all participants, if you've got a case to present, to please get in contact with Ali Sullivan. You don't have to bring your most complicated case. You can bring, something that's just posed a challenge to you that you'd like a bit of support with, but you are, of course, welcome to bring, challenge us with something really tough like Amanda has tonight, but we do also accept less complicated cases with delight. A reminder also that registrations are now open for the Diabetes Masterclass on June 14th in Dubbo. It's an in-person event. There will be a link posted in the chat to register. There's a couple of other things on the wing. So there's the Western and Far Western New South Wales Diabetes Educators Network launch on the 31st of March. So if you're a diabetes educator or credentialed diabetes educator, please consider joining up with that. And there's a couple of other things that I got in the emails that you may be relevant to your practice or not. So if you're an LHD employee, there is an ability to apply for a grant to attend the Australian Diabetes Congress later in the year. Check your emails, will be in there somewhere. And also the RDN through Care Partnership Diabetes have sent out a expression of interest for some novel models of care. Again, check your emails if that's in there. There's some fantastic programs that they're looking to support you in your general practice or AMS to develop. Really looking at getting diabetes kicking out in Western and Far Western New South Wales. So look forward to seeing you all in a month's time for our second session for 2025. Thanks very much everyone for joining us, and good night.